Did you know that stroke is the third leading cause of death in the United States? According to the American Heart Association, approximately 800,000 people experience a stroke each and every year in the United States. This is a map of the stroke death rates in the United States, ages from 35 and up, from 2000 to 2006. Strokes account for 1 out of every 18 deaths in the United States. Every 4 minutes, someone is dying of a stroke, and every 40 seconds, someone is having a stroke, which is kind of scary to think about. There's two types of strokes, which are ischemic and hemorrhagic. Ischemic is more common than hemorrhagic is, and it's 80% of all strokes. It's narrowing of arteries in the neck and the head, and the cause of this is blood clots and traumatic injury. This is a picture of a brain that somebody had a ischemic stroke. And hemorrhagic stroke is less common, but it's more fatal, and it's only 20% of strokes. Blood vessels burst within the brain, and what causes it is high blood pressure, trauma, and infection. This is a picture of a blocked artery and a ruptured artery. There's two types of risk factors, controllable and uncontrollable. And these are some of the controllables, which are high blood pressure, heart disease, diabetes, smoking, high cholesterol, and stress. And these are just some of the pictures that go with it. The other one's called uncontrollable risk factors, which doesn't have as many, but it's increasing age, gender, prior stroke, and race. And these are just the pictures that go along with it. The most important thing for all of us to know is the symptoms or the warning signs of a stroke. The symptoms of a stroke is sudden numbness or weakness of the face, arm, leg, especially one side, sudden confusion, trouble speaking or difficulty understanding other people, sudden trouble seeing with one or both eyes or blurriness in your vision, sudden trouble with mobility, dizziness, loss of balance, coordination, or control of muscles, and sudden splitting headaches accompanied with extreme pressure and throbbing sensation. Symptoms suddenly occur, and symptoms differ depending on the part of the brain that's affected. Multiple symptoms can happen at the same time. It's important to recognize a stroke because time lost is brain loss. This is a picture of a emergency treatment. This is a picture before treatment. Somebody got treated for a stroke, and this is after. And you can tell the difference because in the after treatment, there's more blood flow to the brain than there is before getting treatment. And this is something called FAST. It's a test for recognizing and responding to stroke symptoms, and each of the letters means something. F is face, which is ask the person to smile, and does one side of the face droop. A is arms, which you ask the person to raise both arms, does one arm drift downward. S is for speech, ask the person to repeat a simple sentence, and does the speech sound slurred or strange. And T is time. If you observe any of these signs, it's time to call 911. These are some of the prevention strategies, and these are just different pictures, meaning don't do drugs, try not to drink a lot, exercise, eat healthy, take your blood pressure, and don't smoke. This is a picture of time when someone has brain damage. The prevention is the key to a healthy life. Be able to identify your controlled and uncontrolled risk factors, recognize symptoms of a stroke, and know the importance of immediate treatment. Remember that time lost is brain loss.